Sponsored by Regeneron and Sanofi.
My name is Sarah. This is my daughter, Liv. Liv is a high school teenager, loves sports, hanging with her friends, creating art. She was also diagnosed with eosinophilic esophagitis.
I wasn't diagnosed with EOE until I was 13, but I think I've had it my whole life.
Liv has had reactions to different foods, everything from melons, honey, some vegetables, soy products, eggs for sure. Liv's reactions were often coughing, choking, throwing up.
When my esophagus is inflamed, it feels really itchy and irritated, and it just hurts a lot.
We tried a lot of different treatments. We just kind of accepted that this was going to be the way life was going to be moving forward. One day our allergist talked to us about DUPIXENT. DUPIXENT reduces the eosinophils in the esophagus that contribute to inflammation. It was a really big change for us. Before Liv started DUPIXENT, I told her doctor about all the medical conditions she had and medications she was taking. Her doctor and I talked about the potential benefits and risks of treatment, including the most common side effects such as injection site reactions and some serious side effects such as allergic reactions that can sometimes be severe and joint aches and pain. We started seeing improvements in her symptoms in just a few weeks. The next time Liv had an endoscopy, we saw a reduction in inflammation. I was very excited for Liv. Of course, this is just our experience. Everyone's experience with DUPIXENT is different.
It's easier for me to swallow. I don't have to think about EOE as much when I'm eating meals or snacks, and I don't have to constantly be checking in on my throat just to be like, am I having a reaction? Is this hurting?
As a mom, it's so great to see Liv eat and swallow with less difficulty, and for her to be able to go out and think less about EOE. Just really proud.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in DUPIXENT. Before using DUPIXENT, tell your healthcare provider about all your medical conditions, including if you have a parasitic Helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine right before and during treatment with DUPIXENT, are pregnant or plan to become pregnant. It is not known whether DUPIXENT will harm your unborn baby. A pregnancy registry for women who take DUPIXENT during pregnancy collects information about the health of you and your baby. To enroll or get more information, call 1-877-311-8972 or go to mothertobaby.org/ongoing-study/DUPIXENT/. Are breastfeeding or plan to breastfeed. It is not known whether DUPIXENT passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have EOE and asthma and use an asthma medicine. Do not change or stop your corticosteroid medicine or other asthma medicine without talking to your healthcare provider. This may cause other symptoms that were controlled by the corticosteroid medicine or other asthma medicine to come back. DUPIXENT can cause serious side effects, including allergic reactions. DUPIXENT can cause allergic reactions that can sometimes be severe. Stop using DUPIXENT and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, joint pain, general ill feeling, itching, skin rash, swollen lymph nodes, nausea or vomiting, or cramps in your stomach area, joint aches and pain. Some people who use DUPIXENT have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop DUPIXENT if you develop joint symptoms. The most common side effects in patients with eosinophilic esophagitis include injection site reactions, upper respiratory tract infections, cold sores in your mouth or on your lips, and joint pain, arthralgia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of DUPIXENT. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use DUPIXENT exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject DUPIXENT. Do not try to prepare and inject DUPIXENT until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended DUPIXENT be administered by or under supervision of an adult. Please see adjacent links for full prescribing information, including patient information.